Tailbone pain, what causes it? Did you fall and hurt it, or you just got tailbone pain out of nothing? It just showed up. That's the subject of this video. I'm Dr. Shakib from Core Pelvic Floor Therapy in Irvine, California. And tailbone pain is perhaps one of the most misunderstood signs and symptoms of pelvic floor dysfunction. If you may have tailbone pain because you were sitting on a hard surface and your tailbone, the bone itself, is actually sore, but most likely it is because of the pulling and pushing and yanking of the soft tissue, that's tendons and muscles and everything else that is connected to the tailbone or coccyx. Unfortunately, it is looked at as if it's nothing important, not that important, until people are really hurting, especially going from a seated position to a standing up or standing up to a seated position. The reason that happens is because the attachments to the tailbone are being worked on and start working, and as a result of pulling and contracting and pushing, or whatever the case may be, depending on the movement, the tailbone becomes loud and painful. Unfortunately, in some cases, which to me is mind-blowing, they remove the tailbone as a last attempt to get rid of the pain. This is after cortisone shots and a lot of other things. Well, that tailbone wasn't put there by accident. It's actually like the tip of a tent that you need to have the stick so you can put the walls of the tent connected to, and that's what your tailbone is all about. By removing it, you're actually causing a disastrous malfunction. So what do you do about tailbone pain? We have to understand what caused it. If there is no incident, not that knowing the incident will remove the cause, but at least we can understand the mechanics behind this pain. What needs to happen is not doing the movements in a dysfunctional manner that will keep engaging that area the wrong way. That does not mean stop doing the activity that does cause pain, but start doing the activity the right way so the activity is not causing the pain. So in other words, you have a dysfunctional way of moving, and I'm saying that dysfunction needs to turn into a functional way of movement. At the same time, it's a good idea to take supplements and nutrition that will allow the tissue to heal itself. Generally speaking, for my patients, when it involves the bones, I do like bone broth, organic, pasture-raised. Gelatin is a good thing. Not a big fan of calcium, but vitamin D is crucial. Those are a couple of things that I mentioned. I also recommend castor oil compress with ginger and turmeric, grated and put on the compress and apply to the area for pain. But back to the mechanics of movement and how those muscles attached to it can pull the tailbone and cause issues. That's when our office does what we do, which is pelvis stability. Every case of pelvic floor dysfunction has pelvic instability that needs to be addressed. And from my observation and what I see, I don't see that being addressed as strongly as it should. We are so busy thinking about the floor without realizing that the wall and the house that this floor is the floor of is unstable. So I hope that this video has brought to your attention the importance of understanding the mechanics behind your tailbone and not looking at the pain. Now the pain is gone and so you're all fine, because that pain can come back. Pain can be masked with medication, but the causation is still there. For those of you who are in other states other than California or out of country that you contact my office, the coaching opportunity information is in the description box. You can follow us on social media and every places that we exist, and use all the methods or any of the methods within the description box to contact us if you need to be seen for an appointment. Until next time, take care.